Hello, you're watching Coronavirus Catch Up. I'm Jordan Kenny. Welcome to the programme. We're live tonight on the BBC News NI website and Facebook page and on the BBC iPlayer for the next 25 minutes or so. Thanks for tuning in. However you're joining us, well, you'll not need me to remind you, although my hair might, that tomorrow marks a major step in Northern Ireland's exit from lockdown. We'll see the return of hairdressers, barbers and other close contact services. Driving tests and lessons will resume. Outdoor visitor attractions will reopen and there will be a return to competitive sports and band practices as well. That's not to mention next week when we'll see non-essential retail and outdoor pubs and restaurants reopen. Tonight we're going to be chatting to virologist Dr. Lindsay Broadbent about COVID-19 variants and going through some of your questions as well. But before we do, our health correspondent Mary-Louise Connolly is with me now. Mary-Louise, good to see you. First things first, are you looking forward to tomorrow?
Absolutely, cannot wait. Really looking forward to it. Mixed feelings though, Jordan, because you feel excited and there's a great deal of optimism. I think the weather out there really reflects the mood that everyone is in, that sense of looking forward and being upbeat. But then there's another part of me feeling, well, there are so many people who I'm sure aren't looking forward to tomorrow for various reasons. They've perhaps had a pretty bad year. And also a lot of people, believe it or not, are still very nervous about going out into the big bad world again and things opening up. So, I think there's a note of caution and trying to get the right balance, I suppose, between that air of excitement, but also still being pretty cautious.
Yeah, definitely. And you mentioned the weather as well. It's great to have this good weather, especially, looking forward to tomorrow. But you've been looking into, Mary-Louise, how safe it is to go and get your hair done. So we mentioned the hairdressers are reopening within 24 hours of having had your vaccine. And it's quite interesting. What have you heard?
Yeah, it was actually a friend of mine raised this. They're due to get their vaccine next week, and then within 24 hours or so, they're booked in to get their hair done, like so many people are. Now, it's not just a case of getting your hair cut. For many of us women, it's all about perhaps getting a colour done, and also close contact services where you could be getting a beauty treatment, perhaps electrolysis or something more, even a massage somebody has suggested to me, because, it is contact. But the advice is, and I did contact the Department of Health, if you have, you're getting your vaccine and you are getting a treatment as such, the official advice is that to go ahead. It should be okay. There is nothing written down in a rule book to state that you could be in any sort of danger or that there could be a reaction. But if you speak to hairdressers and beauty consultants, they're saying, well, first of all, if you wake up the following morning and you might have a headache or a sore arm, they don't want that risk of perhaps doing a colour on you or perhaps doing a treatment and then being held responsible for you being in a worse position later on. Then someone else explained to me, it's all down to their insurance, isn't it? So you might get a phone call, or if you are applying for a beauty treatment, you should receive a survey asking you lots of different questions. So don't be surprised, and you should be honest. If you tell your beautician or hairdresser that you are due to get your vaccine a day or two before seeing them, they might ask you to wait just to be sure that you don't get a reaction.
Well, on the topic of vaccines, Mary-Louise, how are we getting on with the vaccine rollout? We're now down into the 30s age group. It's getting closer to my turn.
Oh, stop. Yes, 35 to 39. And officially tomorrow, really, that goes live. They did go, I should say next Friday, that goes live for everyone. We did hear this week that some places had opened up. And we are hearing that, particularly in the SSE arena, that mad rush that you get with every new age group that opens up, that has come to a lull. So they realised they had a number of places, they had vaccine available, And it just really sets the tone of this whole programme. It's been keeping it going, keeping it rocking along as much as they can. So once they had got through right down to the 40s to 50s, they realised, well, now that we have this lull, let's get the next group in, which is the 35 to 39. And hundreds of people, absolutely. I think it's actually 29,000 people managed to get in that little bit early before the programme goes live for that entire age band next Friday. And it'll keep going like this until we get everyone vaccinated, Jordan, and they still are on schedule. In fact, Northern Ireland has done so well. We are over the million mark. Over 1 million adults in Northern Ireland have now received at least one dose, 883,000 people, in fact, and then the rest have received their second dose. So, it is remarkable, and really a major hat tip to Patricia Donnelly and her team. And also, I think, for not being able to say along the way, we need to get more people in, because actually that certain age group, the 45 to 50 or whatever, at the moment we've seen all we can see. So let's head on to the next group. So really the success is down to them and their team, and for rolling it out across Northern Ireland. And of course the local pharmacies, we should mention them, and also mention the GPs.
Yeah, well, as you say, those numbers there, Mary-Louise, I mean, it's staggering amounts of people who have been vaccinated so far. But although those numbers are high, it doesn't mean we're totally out of the woods yet. As currently in Northern Ireland, we've still got 7 people being treated in intensive care units for the virus.
Yeah, and as I said to you in the opening of this, Jordan, it is all about getting the balance. I said we are excited. There is a degree of optimism, but I think it's at this point I'm going to be negative Nancy and mention that we're not out of the woods yet, far from it. And while we are in a good position now this evening, if we want to continue being in this position come June, even come the autumn, we still need to be cautious. As you say, there are 7 people down into single digits, which is excellent, in ICU. I understand that 2 of those patients have in fact received their vaccine. One of them has had 1 jab, the other has had 2 jabs, but I understand what clinicians feel. Their condition would have deteriorated even further if they hadn't have had the vaccine. So the vaccine has protected them. And remember, it is just 2 patients out of over 1 million people who have received their vaccine so far in Northern Ireland. One, I understand, may have had underlying health conditions. We don't know their full histories. It is still a small number. But we're also concerned because along the border areas in Northern Ireland, many people still aren't vaccinated. And that is worrying for the authorities, because in those border areas, well, a lot of people are still vulnerable, and that is a problem. And COVID is still out there and can still be passed on to other people.
You're right. And, there's one of the good things about broadcasting during lockdown. Sometimes the iPad will fall over. but Mary-Louise, just for clarity though, the fact that those 2 people in ICU have had their vaccine, that isn't something, that should deter people from getting your vaccine. It's still very much been a factor in helping these people.
Yeah, absolutely. And, the vaccine has protected and saved thousands upon thousands of lives. You consider where we were this time last year. And I'm sure, Jordan, in one of our many conversations, we talked about the hope of getting a vaccine. And then the vaccine came along in December. And while we did have that huge surge and peak in cases and hospitalizations and sadly deaths, so many months on, so many, and we are opening up, and we will hopefully continue to open up. We saw tonight the First and the Deputy First Minister actually having a laugh with each other. Michelle O'Neill talking about going to get her hair done tomorrow. And that joviality, that reducing the tension somewhat, and that still leadership between those 2 women is all so important, because we aren't out of the woods yet. We still have to get more people vaccinated. The virus is still out there. But I think all of that will help, and that constant reminder, and I will be doing this across all the platforms, that we still have to be cautious. We still have to keep our distance if we want to continue enjoying the easing of restrictions and getting out to the beer garden and getting our hair done come June, August, September, October. It's in our hands. It's in our gift that we continue being cautious and that the hospitals aren't being swamped. Because what I was warned today, not only are they preparing for another wave come October, they're also preparing for a massive flu wave too, because we didn't have flu last year, we didn't have respiratory illness, and that it is going to come back. So we could have a double whammy of COVID patients being treated alongside flu patients, and that is worrying.
Well, one more before you go, Mary-Louise. Like you said, we're being told to be cautious, keep remembering the basics of hand washing, mask wearing, social distancing. But Tom has been in touch, though, and he's asking us, if you've had both doses of your vaccine, do you still have to wear a mask?
Yes, because while we are singing the praises of the vaccine, remember, it has only been in circulation since December. It is still the unknown in some respects. We still don't know what it's capable of protecting, and also as new variants come on board, and Lindsay will get on to that a little bit later. We have the Indian variant in the Republic, and we don't know just to what extent the vaccine can stand up to this new variant. So we still, yes, have to be cautious and still wear your mask and still wash your hands and still socially distance until we know an awful lot more about the vaccine and if it can stand up to these other variants. Because while we know about the Indian and the Kent and the South African, we never know what's around the corner.
Well, Mary-Louise, thanks for that. And thanks for joining us on Coronavirus Catch Up. It was good to have
Jordan,
you back on tonight.
Can I ask you a question?
Go for it.
When are you getting your locks cut?
My hair has been the topic of so many conversations in this newsroom, Mary-Louise, and my own parents. They keep giving off at me and telling me to go and get it cut. So this week is the week. If I can find an appointment, my hair will be much shorter this time next week.
Enjoy your haircut and enjoy a safe pint in a beer garden.
Thanks, Mary-Louise. You too. Chat to you later. And I should just mention, if you're watching the program on Facebook tonight, feel free to get involved in the comment section. I see we have some questions coming in already, but if you have any thoughts or questions about what's being discussed, leave them in there, and we'll try our best to get to them before the end of the program. Now, although the restrictions are easing and we're moving out of lockdown, it hasn't all been good news this week. A new Indian variant of COVID-19 that Mary-Louise was just talking about there, of which there has been more than 100 cases confirmed in the UK, has been grabbing headlines. Dr. Lindsay Broadbent is a virologist from Queen's University in Belfast, and she's with me now to answer your questions about this. Lindsay, thanks for coming on. First of all, talk us through this new variant. Why is it concerning?
So this new variant we're calling the Indian variant, which is also known as B1617, has those mutations in the spike protein. And that's really one of the things that scientists look out for, because obviously all the vaccines that are currently licensed are all directed against the spike protein. So the worry is, if that protein changes too much, will the vaccines not be as effective against a variant? There's some suggestion that this Indian variant is more transmissible, just like the UK variant or the Kent variant was more transmissible, and other variants that have popped up around the world seem to be being more transmissible. At this stage, though, we don't know if it is any more deadly than any of the variants that we've seen so far.
Well, as I said, Lindsay, we heard earlier this week that there has been more than 100 cases of this variant detected in the UK. There's also been some cases discovered in the Republic as well. But how much of a risk is it to us in Northern Ireland, especially as, you know, our lockdown's easing from tomorrow and we begin to come out of this period of lockdown?
As I just said, we don't know if this variant is any more deadly. So really, we are treating it like we would treat any SARS-CoV-2 variant. You have to do the same things. So follow the guidelines. If you're within one of the age brackets to get vaccinated, make sure you do that. And really just kind of avoid those situations that are more high risk, such as enclosed space with a lot of people, prolonged contact with a lot of people. Those are the things we want to avoid to try and reduce the risk, not just of transmission variants, but of transmission of any of these viruses.
Well, is there any evidence to suggest, Lindsay, that any of the COVID vaccines that are being given out here in Northern Ireland would be less effective with this variant, or even any of the other variants, such as the UK variant or the Brazil or South Africa that we've been hearing about?
So the way the vaccines work is that they have they create an immune response against that spike protein that I was talking about. But the immune response and the antibodies that are made against that spike protein are lots of different types. Lots of different bits of the spike protein can have antibodies against them. So if that spike protein only has 1 or 2 mutations, then the chances are that the vaccines will still work. And we know that for things like the UK variant, the South African variant, the Brazil variant. The vaccines that are licensed are still effective against severe disease, and they do still protect against death. And we think that that will be the same for this Indian variant. But what we don't yet know is how effective those vaccines will be against mild cases of these variants. It might be more likely that these vaccines can still infect us, but possibly just not cause severe disease.
And Mary-Louise mentioned there when we were chatting just a few minutes ago about the fact that we could see a resurgence of flu coming this winter. Is that something that's of concern to you?
It's not we don't have to worry overly about it. We don't have to be overly concerned at this point, but it's just something that we need to be aware of. It is likely that when we start mixing again, when everything opens up again, all of those seasonal viruses that we're used to getting, all of those viruses that kind of, when we talk about something that's going around, those are going to come back again. So things like the common cold, things like flu, other viruses that people don't talk about as much, like RSV, which affects kids, those are going to come back. Hopefully they'll just come back as we expect them to, and there won't be any huge upsurgence in incidence.
Well, moving on from variants, there's been discussion over the past number of days that we should be prepared for a surge in COVID-19 cases during the summer. Yesterday, Professor Adam Finn, who is a UK government scientist, he said it was likely that we would see a surge in cases during the summer. But Lindsay, is this really a reality that we're facing?
We are going to see an increase in cases. I think we have to accept that. But if the vaccine does its job, and if our vaccine uptake is really high in the population, if we're preventing deaths and we're preventing hospitalizations, then hopefully that uptick in cases won't be severe enough to affect things like the health service. So I'm hopeful that we won't have another lockdown. I'm hopeful that restrictions will not be as severe as we have seen them either in the first lockdown or the second. If they're needed at all, they may not be. And I'm really hopeful that they won't be. And that is in large part thanks to the vaccine rollout.
Well, that's actually what I was just going to ask you, because whenever we say surge, our minds automatically go straight to another lockdown, more pressure on the health service and things. So it's reassuring, I suppose, to hear you say that that's hopefully not what you're expecting to happen. But what do you think I suppose, would this look like if we're not going back into lockdown but cases do surge? How does that manifest itself?
So we can look at countries like Israel, who are much further on in their vaccine rollout program. They're almost reaching herd immunity within the general population, which is incredible. They're a few weeks ahead of us in terms of the vaccine. And they have opened up their economy again. They've opened up businesses and hospitality. And even though they're pretty much completely open, cases have still continued to decrease. Hospitalizations have still continued to decrease, and they didn't see any major increase in cases. And we think that is due to the vaccine rollout and to the fact that they have such a high proportion of the population vaccinated.
Well, Lindsay, the most popular question by far we've had this week that we've been having sent in by people is asking about when the advice to quarantine for 10 days after returning to Northern Ireland from England, Scotland or Wales will either be eased or removed. Mike has been in touch about it, as has Katie, Gemma, a lot of others as well. Appreciate you're not on the executive and you're not responsible for making the decisions. But from your perspective as a virologist, is it something that would be safe to do, to remove this 10-day quarantine for travel to Northern Ireland from England, Scotland or Wales?
As you say, I don't make these decisions, and I'm glad I don't make these decisions. I think the reasoning behind this is that if cases are low across the UK, then the risk of travelling back and forth from Northern Ireland to England or Scotland or Wales or vice versa is relatively low. You probably have as much risk of getting the virus here as you would there. So I can't see this being advice for much longer. However, what does complicate the issue is that Ireland, south of the border, are behind us in terms of their vaccine rollout. So they have about 22% of the adult population vaccinated, compared to us in Northern Ireland, who have about 61% of the adult population vaccinated. So there is some caution around the border, around travel north and south here, and how that could be impacted by people travelling from Northern Ireland to England, Scotland or Wales or vice versa, and if those people are likely to travel to border counties or across the border. So I understand it's an incredibly complicated thing for the executive to decide, and as I say, I'm very grateful it isn't my decision.
As am I. But just before we finish, Lindsay, just to go back to variants briefly, are you concerned about maybe the possibilities of new variants coming up later this year or later, I don't know, anytime in the future?
So the thing with variants is they're only going to happen in areas where there is transmission. So if we can get transmission of this virus really low, then the likelihood of variants popping up is really low. That's why we're seeing variants named after places essentially that had high transmission when these variants popped up, like England, south of England, South Africa, Brazil, and now India. The variants that have popped up so far, we need to keep an eye on, but I'm not overly concerned about. What I am concerned about is any of those variants mutating further, which is why there are efforts at the minute to do what's called surge testing in parts of the UK to try and limit the spread, in particular of those variants, so that those variants don't have a chance to spread lots and potentially mutate even further. And what we don't want is them to mutate into a virus that's either more deadly or can escape vaccination. So at the minute, this is not something for the general public to be concerned about. This is just something for scientists to keep an eye on.
Lindsay, we'll leave it at that, but thanks for coming on and taking those questions tonight. We really appreciate your time. Briefly, just before we finish tonight, we'll just give you an update on the latest coronavirus figures for Northern Ireland from the Department of Health. 3 more COVID-19 related deaths were recorded in Northern Ireland in the past 24 hours. The total number of deaths is now 2,140. A further 120 people have also tested positive. There are 62 people in total being treated for the virus in hospitals here, and the R number is sitting at between 0.7 to 1.05. Okay, well, we'll have to leave it at that for this week, but thanks again to Mary-Louise, our health correspondent, and Dr. Lindsay Broadbent, the virologist from Queen's University in Belfast, for coming on and going through it with us. Lots of you were in touch with us to send in your questions this week, and thanks for doing that. Apologies that we didn't have time to get to them all, but hopefully we've still helped you make sense of what's been happening and of what's to come. If you're watching tonight and you still have a question that you want answered, send it in to us. You can email it to bbcnewsni@bbc.co.uk, putting coronavirus catch-up in this subject, and we'll try and get the answer to it next week. Don't forget, you can keep up to date with all the latest developments on the BBC News NI website, which you'll find at bbc.co.uk/NI NI. And you can follow us on social media as well. If you're watching on Facebook, you'll have already found our Facebook page, but we're on Instagram, Twitter, and YouTube as well. Just type in BBC News NI when you're on there and you should find us. And I'm also just saying, we had a comment on Facebook from Sally who's telling me not to cut my hair. I'm going to frame that comment and also send it to my parents. But that's it from us for this week. We'll be back with another coronavirus catch up again next Thursday, when who knows, my hair might be shorter, it might not be, and we'll be limbering up for the reopening of non-essential retail and outdoor hospitality. I'll see you then. Stay safe.